Greetings, I'm Dr. Steve Tashiro, and the theme of this presentation is Why We Die and How We Live. And this will be an overview and description of how at Colorado Life-Changing Care, my practice, we go about assessing and supporting patients who have complex chronic conditions. Like medical doctors, chiropractors are primary care providers. But there is an important distinction in our philosophies about health and healing. Medicine is described as, or defined as, the diagnosis and treatment of symptoms and diseases with drugs and surgery. This has been described as a mechanistic or outside-in approach. Chiropractic, on the other hand, along with other alternative approaches such as acupuncture, naturopathy, is described as a vitalistic approach, meaning we recognize that within the body is a vital force, we call it life force or even innate intelligence. And given the opportunity, this innate power, you might say, has the ability to create healing, provided that imbalances and restrictions, blockages are addressed. Now there's another very important distinction between the approach of medicine and the approach of vitalistic providers. In medicine, this is the age of specialization. So if you have a chronic GI problem or acute GI problem, you may end up in the office of a gastroenterologist. Likewise, a pulmonologist will look at your lungs in a great amount of detail. There's a specialist for the kidneys and etc. And it is important to have in-depth understanding about specific areas of the body, provided that doesn't lead to a loss of the overview, because ultimately our bodies are holistic, consisting of many organs, systems, tissues, ultimately cells working together to create health. And while we divide the body into various systems for ease of discussion, really that's arbitrary because the body is not segmented. It's one whole integrated unit. And in holistic care or alternative care, this is a very important view. So I want to talk more about this using a diagram to illustrate. We can once again arbitrarily say that there's three components to health and function. There's physiology, which relates to internal organ function. Simply put, anything that goes squish if it's squeezed. And this is a domain of medicine. This is the area where medical doctors do their assessment and treatment. Of course, the treatment choice is drugs and ultimately surgery. In a holistic approach, we would support physiology with diet. We'd use nutritional supplements, herbal supplements, homeopathic remedies. S and N stands for structure and neurology. The structure would be the spine, extremity joints, and the tissues that support them, muscles, ligaments, and tendons. Neurology refers to the brain, spinal cord, and the nerves. And down here we have mental and emotional aspect of health. So this relates to simple questions and considerations such as, are we happy in our life? Are we content? How do we manage the inevitable stress that we all face? Now, what's important to realize is that these three components are constantly interacting with each other. For example, Candace Pert's book, Molecules of Motion in 1997, was a groundbreaking description of how states of mind and emotion have an immediate direct impact on physiology. She identified in her book and described the fact that for every emotional state, there is a corresponding body chemistry. For example, if you're angry, your body chemistry reflects that state, and it doesn't take very long. It's a matter of seconds before the molecules of emotion reflecting anger are coursing through your bloodstream. Likewise, depression has a corresponding body chemistry, as does happiness and a sense of purpose. That's not the only way in which these three sides of the triangle interact. We know that your brain controls your whole body, including organs. But we also know that your body chemistry and organ function is important for providing fuel to the nerves and the skeletal system and the muscular system. We also know that if you have low blood sugar, as an example, or low thyroid function, that'll impact your mental and emotional state. It'll create anxiety, worry, fatigue, depression, etc. So all of these components that make up who we are as people are constantly interacting. Cells are talking to each other, not only through hormones, but through electrical signals. And so in a holistic approach, we have to take into account the fact that we can't just focus on one area of the body, i.e. the area of complaint, and just work there. We've got to look at you as a whole person. So here's a simple illustration of what this means. So let's say that you have a chronic, tight, painful butt on the right side. And the muscle there is constantly in spasm, and it just kills you to sit down, get up is painful, and even walking is difficult. Well, it could be that the overcontraction of the muscle on the right butt is secondary to a weakness of the same muscle on the left. So to address this problem, we would not only stretch the right muscle, we would strengthen the left muscle. And this happens more often than you might think. In fact, in Chinese medicine, this is referred to as the 50% rule, which means that half of the time the problem is not where the symptom occurs, but on the other side of the body or the other end. For example, problem in the lower extremity, feet and legs, half the time is coming from something in the upper part of the body. Likewise, a problem on the right side, half the time is coming from an imbalance on the left, or a problem on the front of the body is coming from an imbalance on the back of the body. So this is a very important principle to keep in mind as we go about unraveling complex chronic health conditions. A very important principle in this process is realizing that our bodies have a healing priority. Ultimately, our bodies know what they need in order to heal, and in order to unravel a complex chronic condition, it's very important that we listen to what your body is saying. There are various ways that we can listen to your body and read its signals so we can work in conjunction and in concert with your body, not against it. Now, to understand how we go about this process with a chronic condition, it helps to understand how we get sick, ultimately why we die. And so I'm going to put a diagram on the board here that will allow us to take a look at that. Okay, I want to share an analogy with you. Let's say you're a homeowner, and out in your backyard you have a tool shed. And there's a terrific windstorm, and the tool shed blows down, just crashes. So you've got shingles and lumber and nails all over the place. You don't have the time or the energy or the money at that point in time to repair the shed. So to keep the kids from playing on the debris and to cover up the eyesore, you put a fence around it until such time that you have the energy and the money and the time to work on it. Well, our bodies operate in a similar way. If our bodies are unable to resolve health challenges, they will sequester those challenges until such time in the future there is adequate resources, reserves, energy to address that issue. One example would be toxicity. We know that if we're exposed to environmental toxins, that in order to survive, our body will surround those toxins with fat tissue, or it'll put those toxins in fat tissue. This is one reason why people who are overweight may be able to lose the weight temporarily, but then it comes back. And that happens if the detoxification approach does not have an element of detoxification. Because once you've lost weight, but you haven't detoxified, the percentage of body weight consisting of toxicity is even greater than before you lost the weight. So the weight comes right back on. So let's look at how that applies to the development and the onset of a chronic health history. So we begin understanding that, based on a study done in U.S. hospitals, the moment we're born, we have an onslaught of toxic challenge. studies of umbilical blood of newborns shows an average of 200 toxic chemicals. And some of these chemicals are breakdown products from substances like DDT that haven't been used in the U.S. for over 30 years. Where did the fetus receive these toxicities? Obviously from the mother. They go right through the umbilical blood. So as soon as we're born, we have two strikes against us. So let's say that you are such a newborn, and at age 5 you start developing a skin rash that turns into a very difficult case of eczema. And eventually your mother resorts to the use of topical steroids because this is getting out of hand. And the steroids seem to bring the condition under control, reduces the inflammation. But at the same time, the steroids go through the skin and they end up in the intestines where they damage the friendly bacteria that live there. Understand that 80% of our immune system is in the intestine, so this is really damaging the intestine. Well, the eczema could be secondary to the fact that part of what you came into the planet with was arsenic, downloaded from your mother. We know that arsenic shuts off components of what's called the methylation pathway that allows us to break down histamine, which is involved in allergies, including skin allergies. So that's why the eczema developed, but typically no one these days, especially in traditional healthcare, asks why and looks deeper. So anyway, steroids are used, controls the symptoms, but creates another problem. Then at age 10, because the immune system is compromised, you develop chronic infections, ear infections, upper respiratory infections. They come and they go, but they're quite a pain in the ear. And so eventually the approach that's used is antibiotics. Now the antibiotics may squelch the symptoms initially, but again it's creating further problems because the antibiotics also damage the immune cells in the intestine. So now the immune system has become confused, and it allows you to slip into a stage of immune function that we call autoimmunity, and this is where the immune cells actually attack healthy tissue. And you have developed a specific type of autoimmunity in which the B cells make too many antibodies, which are now tagging self-tissue, which are attacked by the immune cells. So at age 20, because of this immune confusion, you develop serious allergies, environmental allergies, and even multiple chemical sensitivity. The drug of choice for this condition, of course, is antihistamines. And the antihistamines, again, control the symptoms, but don't address the underlying causes, which again go all the way back to what you were born with. One component of autoimmunity, which develops in your case, in this example, is neurological autoimmunity, in which immune cells begin attacking the cells in your brain. So this leads ultimately to chronic depression. And the remedy of choice for that may be Prozac. Now, Prozac, according to some studies, will increase inflammation in the body. And so by age 40, you have this rampant inflammation, which manifests in the following way. One morning, you bend over to pick up the newspaper, and you wrench out your back. And it leads to massive inflammation, disabling pain, ultimately necessitating the use of Vicodin, which is a narcotic, and ibuprofen, which tears up your stomach. Now understand the newspaper wasn't that heavy. It was the fact that there was chronic inflammation weakening your structure that led to that acute injury. Okay, now there's inflammation in your body that still hasn't been addressed, and that's causing a spike in the stress hormone cortisol. So now you're unable to sleep at night, and this goes on for a few years until you finally give in, throw in the towel, and you consent to go on Ambien, which is a sleep medication. Now here's the kicker. Ambien is designed for short-term use, a few weeks at most, but they forgot to tell you that. So you've been taking it now for several years and not realizing that your loss of memory or your cognitive decline is related to the Ambien. So now, because you don't know there's a connection, you keep using it, and now you're 80 years old, you have dementia, and you're actually in a nursing home. And you're on a total of 12 medications, half of which are being used to treat the effects of the other half. And some of those are the medications you've been taking your whole life, because the underlying issues that gave rise to those early symptoms was never addressed. So we refer to this approach to healing or healthcare as suppressive therapy. So that's a term that's used in Europe, where there's a greater appreciation for this holistic approach to healing that I've been describing, and it's referred to as biomedical medicine. But unfortunately, it's definitely not the mainstream approach today. All right, so let's say you come to our office and you have a history similar to this, and you're on medications and you have multiple system symptoms. How do we go about unraveling this condition so we can begin helping you? Well, this is where we have to step back and again realize that our bodies have a healing priority. And the priority for this point in time may not be the most recent box. Sometimes it is, but not always. The priority might not be the box that is creating the greatest symptoms. It may be a box that is leading to a compensation that causes the greatest symptoms. By the way, these boxes would be like you put a problem in the shoebox, you put the shoebox in the closet, and you keep it covered until you have time to sort through it. Well, that's kind of what our body does. So in the healing process, we ask your body through what's called kinesiology, which of these boxes it wants to work on. We select that box, we take the lid off, and start cleaning out what's inside. And as we do that, you might have a number of responses. You could feel a burst of energy because we're removing that burden from your body. If that happens, we advise you to follow the 80% rule, which means do 80% of what you think you can, because if you expend all your newfound energy in outer activity, it doesn't leave any for healing. So that's the 80% rule. You might, on the other hand, experience a worsening of symptoms, or even a return of symptoms that you had more actively previously and they kind of went away. So those are some of the possible responses, and we've learned through experience to not get too caught up in how your body is responding to the support that we're providing you, because it's all your body's way of moving through these layers that need to be cleaned out, need to be addressed. We call this recycling, and it's an important concept to understand as you go through a program of care whereby we're looking at the underlying causes for the myriad of symptoms you might have. I mentioned kinesiology. This is a very important tool that we use in order to receive the communication from your body. And to see information about that, you can go to our autoimmune website. It's www.naturalautoimmunerelief.com. Then click on the kinesiology tab. Okay, so patients often ask and want to know, once they embark on a process of healing in the manner that I described, how long does it take to feel better and feel like their health and function is where they want it to be? Well, here's a broad guideline. For every year in which a chronic condition has been present, it takes approximately 1 month of natural support and care in order to reverse the damage done to your body through that 1 year of chronicity. So if you've had a problem for 20 years, you're looking at a couple of years of natural supportive therapy. The good news, though, is that as soon as you begin that process, it becomes evident that a change is occurring, even though there may be new symptoms, as I said. There's also, at the same time, a recognition that there's a different state that's happening, that's taking place, that's moving you towards greater health and healing. And so our job here at Colorado Life Changing Care is to provide you with the education, the motivation, the encouragement, even hold your hand if necessary, as you begin this process of health and healing, leading to your ultimate goal of being functional in your life. So at our office, we see our mission and role, that of helping you take those steps that will allow you to ensure that the rest of your life is the best part of your life. So we look forward to beginning that journey with you and getting started.